Hey everybody, I am here with Mr. Jon Wolfe at Austin Ketamine Clinic. You can find them at austinketaminclinic.com. So we're here to talk about their experience working with patients on their mental health and with ketamine. So Jon, thanks so much for joining us today. I really appreciate it.
Absolutely.
Yeah,
Glad to participate and be involved.
definitely. And I wanted to start off just talking about how long you've been working with patients and ketamine.
So my partner and I started in 2018. I've been a paramedic for quite a number of years. I started EMS back in 1998. So I worked for the city of Austin for a long time, doing special operations, rescue, and whatnot, and ended up body kind of fell apart quicker than the mind, and I had to find a new passion and rediscover what my future was going to entail, and stumbled into ketamine. Really didn't have much of an idea what it was before we started working in it. And within 3 weeks, seeing somebody go from kind of down and distraught and hopeless to 180 degrees the other way and experiencing joy and happiness, there was no better feeling than being a part of somebody else, being their journey back to being like, oh, I can be happy again.
Yeah.
There is a purpose for me as well. So yeah, we started in 2018, worked for a couple other clinics and helped get them operational and going in the area. And then early 2020, right before the pandemic, we opened the doors for our own clinic. And fortunately, our business model was not set up for volume, so the pandemic really didn't have much of an impact on us.
Mhm. Okay, yeah, that makes sense. And I wanted to find out from you, what do you feel like are some of the the biggest mental health concerns that you've really seen kind of pick up over the last couple of years with COVID and everything?
So the social isolation leads to more depression and suicidality, and just kind of that feeling of hopelessness and not having that community. So I would say in order, depression, suicidality, and just overall substance use, not necessarily abuse, but just increased use across the board for all substances, legal and illegal.
Definitely. And do you feel like there's some, things that, people can do to really, just practice like mindfulness and really be able to kind of improve their mental state, outside of, really seeking professional help?
Absolutely. I mean, as wonderful as ketamine is, it takes a lot of other things to pair up, and lifestyle changes, diet habits, sleep habits, avoiding things that are going to upset you and be triggers, i.e. news and certain social media. And I mean, just limiting your exposure and being a little bit more aware of kind of what you're putting yourself in, what type of environment you're in. A lot of that can do a lot of good and help someone even without medications or psychedelics. And there's no miracle cure in pharmacology,
Sure.
unfortunately. But it's a compounded result from all of the additional adjunct items that one can do to help themselves.
Yeah, definitely. I think that's a great point. I think it, is part of a process and maybe a good tool for people, but, definitely sounds like there's, some work to be done alongside it as well.
Yeah, so I use a very, not crude, but the analogy I use is we all have a backpack of bullshit.
Mhm.
And each one of us have a backpack that's unique to us, our traumas, our experiences. It weighs differently, it's packed differently, but they all have kind of the same theme. And you didn't fill that backpack up in a day, you're definitely not going to unpack it in a day.
Mhm.
The deeper you go into the bag, the harder those things are to process and, kind of pull out of the backpack and get rid of it. But yeah, it's definitely a journey, and yeah, it's a process, and patience is kind of the ultimate, um, self-compassion and patience.
Yeah, yeah, absolutely. That's a great point. And what are you seeing are the most, common mental health issues and symptoms that you guys have been able to treat with the ketamine?
The most responsive condition is the suicidality. Dr. Calabrese, she's a psychiatrist up in the New England area, and she's done a few studies with ketamine and suicidality and published them. And just in her studies, it's a very limited number, because that's kind of the challenge we face as a industry with ketamine. It's just the amount of participants we have for those research trials.
Yeah.
But suicidality being the top,
Mhm.
and then depression and anxiety disorders such as like PTSD, or yeah, many different forms of other anxieties. OCD, substance use, especially alcohol use, has shown to be extremely responsive to it. Um, and as well as we've had a few patients that have had Tourette's and other, I would say, brain disorders as a general term, that have responded well to ketamine. But it is a treatment that requires ongoing maintenance and care. So it can be a little financially, the financial challenge is definitely legit.
Okay, yeah, that makes sense. And do you guys primarily focus on the IV infusions there, or what is the the route of administration you guys work with?
So we do focus primarily on intravenous. We're not, we do have protocols for intramuscular, and depending on kind of the patient's response and how they did through their initial mental health series, we do have an option to utilize an outpatient prescription of compounded racemic ketamine for them to use at home in a controlled setting, and that helps them maintain for a little bit longer between needing to come in for those maintenance booster infusions. And overall, it just helps reduce that financial impact and make it a little bit more accessible and affordable across the board for a lot of people. But we mainly focus on intravenous because of the control over the pump and the infusion and that direct intervention. Intramuscular, yeah, once you put it in the muscle, you're not sucking it back out. You're in that experience. You can't really stop the experience, but having the control through a pump, and as soon as you hit stop, you can set your watch to it. It's a quick onset, and it's a fairly quick recovery. And within minutes, you can get somebody back in their body and out of a difficult or unpleasant experience. The pleasantry of the experience is almost more important than the dose of the ketamine.
Okay, and so you want to see somebody, you want to see how they're responding to it before you decide, to keep going with the dose.
Yeah, so everybody on their initial treatment, we start off at weight-based dosing from the National Institute of Health. I think it was 2006 when they did the initial clinical studies evaluating ketamine infusion therapy over a series of multiple infusions at a 0.5 milligram per kilogram dose. Their studies were based on a 40-minute infusion. We do 60-minute infusions because we found that if we can kind of stay in that space a little bit longer and kind of maximize each treatment, then those results get compounded pretty significantly. And it really helps to have a good, nice introduction to something, and then we'll gradually escalate the dose based on their response and feedback and kind of, yes, how they're doing and whether it's remaining pleasant.
Yeah, it definitely makes sense. And what are some of the results that you've been seeing with the patients, compared to, especially ones that have done, just traditional antidepressants?
It's pretty significant. So our patient 0, she, as a matter of fact, came in today, and she struggled very. She's well educated and very knowledgeable, but she struggled with suicidality pretty much from her teenage years on, even to the point that she's made attempts and has had to be admitted and have a transplant and certain things because of it. And ketamine was literally the one thing that worked. Wow. And has worked. And yeah, we've been taking care of her for almost the entire time, for about 4 years now. And she's the textbook example I use of how someone can be so distraught and just, lost their ambition or motivation to continue to push forward and suffer through some of the challenges.
Yeah.
But ketamine was that mode of treatment that showed a lot more response and a much greater response. We've got, I would say, right now we've got about 200 active patients that come in for regular maintenance therapy. And these are patients all the way. So we don't treat pediatrics, it's 18 and above. But one of our patients, gentleman's a veteran with a huge story of PTSD and 30 years in combat. And every time he thanks us for saving his life. And yeah, that just gives you the warm and fuzzies, and there's nothing better than hearing that. And he frequently jokes, man, I wish I would have had this 20 years ago. Mm-hmm. And I understand. Yeah. The struggle's real, and hopefully we'll be able to make it more accessible to a greater population, because yeah, that struggle is very real.
Yeah, definitely. Yeah, that's great to hear you guys have had such a big impact on those patients' lives and been able to do that for them. Do you feel like, that's something where patients should still try, the traditional route with, antidepressants, or do you think that, we'll come to a point where ketamine might be one of those options that's available a lot sooner?
Short answer is I think we should be moving to ketamine a lot quicker than having to go through, 2 or 3 different antidepressants or whatever to try to treat it. We know that ketamine is extremely effective, and the risk benefit is proven, and yeah, there's no reason for us to sit there and to continue to stew in the same the same pot of water if we've proven with so many others that it's not really effective, and there's more side effects than actual therapeutic benefits from it.
Yeah, definitely. And so what do you usually recommend for patients to do alongside the ketamine therapy? We talked about that a little bit, but do you recommend journaling or listening to music? What do you feel like is the most beneficial with it?
So the primary reason why we opened up our own clinic was so we could control the set and setting and kind of optimize the experience on hang on 2 seconds.
Sure.
So the really important part about receiving ketamine is that set and setting, and being able to feel safe and comfortable enough to let go and lean into it. So our clinic is set up almost like an apartment, and it's not a sterile feeling whatsoever. We don't do transactional based medicine. You're not just here to get a ketamine infusion and we say, all right, thanks for your money. Best of luck to you. Give us a call back when you want another infusion. But we follow up, we make those relationships and actually hear what the person is saying. And that's critical. And being able to identify the other things to suggest and incorporate and kind of encourage them to go out and pursue. Because a lot of people, they've done therapy. They've done many, many years and many different types of therapy.
Yeah.
And some people are just burnt out and they're like, yeah, I tried that before. I'm not really digging it. But as you go through that backpack of BS and start unpacking things, there are times that you're going to need a little bit of guidance from somebody that's their skill set and that's what they went to school for, that can help provide that, direction and assistance with navigating and processing.
Yeah.
After a ketamine treatment, we encourage all of our patients to go home, rest, rehydrate, refuel, relax, stay away from any type of news or social media. Just kind of avoid stress, even if it's good stress. Your body sees stress as the same way. It dumps cortisol the same way, and cortisol is kind of the nemesis for what we're trying to, make happen here with ketamine. And yeah, just putting yourself in a nice, relaxed environment and utilizing those things like journaling or arts and crafts. I personally like to do acrylic abstract pouring art. And yeah, that's kind of my jam for me to get out of my head. So I encourage people to do that. Some people, we've got a patient that actually composes music. A couple others are musicians, and they'll go home and have a session. And a lot of the things that people do as hobbies typically get put on pause or hold during those times of peak struggle, just because the motivation to do it isn't there. The joy you're not getting from it, so you don't do it as often. although we all know it brings us happiness, and yeah, when we do it, we're in a much better headspace. But whether it's yoga, meditation, a guided meditation, or just, breath work,
Yeah.
there are so many different types of things you can integrate, both Eastern and Western. And it's essentially whatever works, whatever is your jam, you should do, and couple and pair up with any treatment modality, especially with a psychedelic modality and ketamine. It helps make those neuroplastic changes and create those new neural pathways to shift that perspective.
Yeah, definitely. I think that's a great point too about, patients have lost a lot of the joy that they had from doing those activities and maybe forgotten, how much they enjoyed them. So,
Mhm.
if they're able to get back to that, I think that's great to encourage them to really start doing those things and probably just, enjoy them all over again.
Yeah, 100%.
Mhm. And for patients that are maybe, not really sure what symptoms they should look out for, or if they should get, professional help, what do you think are some good symptoms or signs they could look out for?
So, of course, they vary with every person, depending on situational life stressors at the time. Yeah, it's much easier to go from happy to hopeless if you total your car, have a loved one die, your partner leaves you, romantic struggles, financial struggles. So those are all kind of, we expect those stressors and know that they're not enjoyable and they kind of suck. But when you get to the point of not being able to manage them in a positive manner, typically it is that, social withdrawal, that retreat, and that reclusive behavior where, you may be the most outgoing person in the world. And now all of a sudden, you haven't left your home in many months. Uh, certain daily normal activities that you haven't struggled with and typically don't struggle with become struggles.
Yeah.
I mean, sometimes getting up to wash the dishes or even fix a meal is a little too overwhelming and can be a legitimate challenge. And of course, the big one is suicidality. If there's two different types, the passive where it's like, hey, if I didn't wake up tomorrow, it is what it is. And then the active where you're actually kind of mapping out what that would look like. And, to go one step further, starting to execute that active plan. Those are 100% times to reach out for help.
Yeah.
And those are the most obvious symptoms. And a lot of times it's not the person themselves that realize kind of how deep they're in their own mind or how much their behavior has changed. It's the friends and family and those surrounding them that are like, hey, man, I haven't seen you in a while. And, are you good? And doing that buddy check is key to having a good support network, because we all need a check-in no matter who we are or what we do. And
Yeah.
sometimes it's us giving someone else a hand, and sometimes we need a hand, and there's no shame in that.
Yeah, definitely. I think that's a great point. It's really important to have that support system and have people that are checking on you and,
Yeah.
really care to see that you're doing okay. And, if you're not, then maybe, they can recommend that you, see somebody or try to get some help with it.
Yeah, on our website, there's a ton of different resources we put on there. They just released the 998 3-digit suicide hotline number. I think in June or July here recently, but yeah, there are so many different resources that are out there. And, if you don't have the financial means or what have you, there's resources for everybody. And sometimes somebody just needs to be, that conversation just needs to be had. And once it is talked about and brought to light, you're like, oh yeah, you may be right.
Yeah, definitely. And then what would be the best way for patients to get in contact with you guys?
I would say either go to our website, which is austinketamine.clinic.com, or email us, which is admin@austinketamine.clinic.com, or call us. Our phone number is 512-744-5489. Any of those routes will be the most direct and straight to us.
Okay, great. Okay, perfect. Yeah, well, those are the questions that I had for you today. So I really appreciate you, taking the time to talk with us and share the education. That was great.
Absolutely. It's my pleasure. I'll never pass up an opportunity to share a story and encourage others to reach out and get help, no matter whether it's for ketamine or at our clinic.
Definitely. Yeah, it's very clear to see you have a big heart for the patients, and I hope you guys are able to keep, seeing patients and being able to help more people with it.
Absolutely. Absolutely.
All right, perfect. Well, have a great rest of your day. I appreciate it.
Thank you very much.
Thanks.